tend to get these all jumbled up. First of all, there's skill. Skills are specific learned abilities that you need to perform a job well. So, as is in the example here, a nurse informatician can be a skilled computer programmer or a screen builder, right? They have that skill. They can perform a job well. Competency, on the other hand, represents a person's knowledge and behaviors that lead them to be successful at a job or occupation. So the nurse informatician, who may be a skilled computer programmer or screen builder, also has to be a competent problem solver, analytic thinker, communicator, collaborator at a minimum, in order for that wonderful screen that they built to be able to be used by end users in an appropriate way. So when we think about what we're trying to imbibe or imbue into students or our practicing nurses, it's both a skill set and a competency. It's both of those things. And we also need to ensure that we support an attitude to do whatever we need them to do at the time. Other terms that need to be understood and are often confused are academic standards. Academic standards are developed by a professional body, whether those are nurse practitioners or nurse informaticians or nurses or leaders, whatever it may be. There is a professional body that defines what a student in that specialty should be competent to do at a specified time. I will be referring to AACN, the American Association of Colleges of Nursing, which develops academic standards for what academic schools of nursing, and there are almost 900 of them, must teach to nurses at all levels: entry to practice, master's, DNP. Then we have educational accreditation. This is the analysis and study of educational programs. It measures the quality of the programs and if they are offered equally to all students in the institution. Accreditation in an educational setting has to be accredited. If you are a graduate or a student in a program that is not accredited, that is a problem. You may not be able to get a job. You might not be able to sit for licensure. You may not be able to go to graduate school. Your program that you enter, regardless of what you're entering, the school must be accredited, because that is a seal of approval that says you are protected as a student, that you are going to get your money's worth, and you are going to be able to fulfill your ambition because this school is capable of giving you what you are essentially buying. In the case of most schools of nursing, they are accredited by the CCNE, the Commission for the Accreditation of Nursing Education Programs, CCNE. I sit on a board called CAHIM, the Commission for the Accreditation of Health Information, Informatics Management Programs. CAHIM accredits both health information management programs at the undergraduate and the graduate level, and health informatics or nursing informatics is included in there, programs at the master's level. So CAHIM will go in and look at your informatics program as well as the structure of what that program runs through, the structure of the department and the school and all that stuff, just like a regular accreditation. And they will accredit the program. Analogous to that is a hospital accreditation. This is a self-assessment and external peer assessment used by healthcare organizations to accurately assess their level of performance in relation to established standards, you know that word again, standards, and to implement ways to continuously improve. You are all familiar with the Joint Commission. Well, if you're in education, having a CCNE review is like getting reviewed by the Joint Commission. You've got a self-assessment you got to do, and then there's peer reviewers that come in and review you, and they talk to the students, and they talk to your advisory board, and they go out to your hiring people, the people who hire your students. They look at everything. So those are just some terms that I want to make sure everybody's familiar with. Now, all of these work together to ensure that we are able to participate successfully in clinical practice and education. But for those of you not in education, I want you to consider that education, the process of education, is somewhat like a factory production line. We have to put out a product that meets a need, right? And that need is coming from a variety of sources. It's coming from society, from federal regulation, from local need to patients to whatever. There are a variety of sources where needs come forward. And education has to always be looking at that and figuring out how to address those needs so that our students can participate fully in clinical practice, whether that clinical practice is taking care of a patient or being an informatician, right? It's all the same. We've got lots of driving forces that shape what is expected of us, that shape the competencies that we have to put into our students through the courses that we offer and the learning opportunities that we give them. And these forces come from the windward side, the leeward side, the top, the side. It's pushing us from every single way. It's like the wind's shaping that mountain. But education, whether you're doing it in a school or you're doing it in professional development, is a lot like that mountain being shaped by the wind, or that barge to the right transporting lots of heavy stuff in the water. We don't turn around very quickly, right? The forces occur very quickly, but we ourselves can't always respond as quickly. So why? Why do we care in our world right now? Well, we are in a technology and data-rich environment, and these are just a few examples that all of us on this call are more than familiar with. We've got banks of computer monitors being watched for data trends external to an ICU or monitoring patients in home. You've got nurses at the bedside working on computers 24/7 as they care for your patients. We have robots like that little guy on the far right doing various things using artificial intelligence and other natural language processing tools, data sciences, in order to deliver supplies, deliver medicine, clean rooms, whatever they're doing. We got the lady in the bottom left who is probably got dementia, who is utilizing a robotic sort of animal to calm her down and interact with her. I actually sort of played with one of these at a MedInfo in Europe. It's a little different, looked like a seal, kind of vibrated, talked to you. We've got nurses imbued with all sorts of technology that they're dealing with. We've got nurses on social media. We've got nurses engaging with patients in multiple ways. These forces are changing, driving what we have to do with all of our nurses, whether they're entry to practice, advanced practice, or informatics nurses, driving the competency expectation of these nurses.